Hi, I'm Tal Blair, and I'd like to introduce you to Motion Guidance. Our product is pretty simple. It's a laser pointer with various straps and mounts that allows you to add visual feedback to any body part. Adding visual feedback to both assessments and treatments allows both the clinician and the patient real-time feedback of neuromuscular control. Additionally, the creativity of the simple device allows endless applications in neurological assessment and treatment, from gaze stability, range of motion, fine motor skill, to gross muscle activity and stability and balance and dynamic movement. Concussion involves a variety of different affected domains, thus is not a one-size-fits-all treatment approach. A multifaceted approach to rehab is warranted. Treatments could include cervical spine proprioception drills, motor control activities, but also balance systems and vestibular systems, as well as global body awareness during progressively complex tasks. Let's take a look at some of the applications, starting from general cervical motor control, positional awareness, and vestibular treatments, progressing to full-body proprioceptive tasks with challenges. This video demonstrates cervical joint positional awareness testing. It can be used as both a test and training for your patient to sharpen their positional awareness skills. The patient centers the flag and practices a motion fully in one direction, such as rotation, and attempts to come back to target as accurately as possible. During the motion, their eyes are closed. When they think they are back in the place they began, they can open their eyes and check their accuracy. You can apply this assessment concept to any body part or movement of any body part. The motion guidance system comes with various tracking grids that you can hang on your wall. These are great for cervical motor control exercises. You can work in clockwise, counterclockwise, big or small butterfly motions. This will give you an idea of the patient's fine motor skill, an ability to track in different directions, ranges, and in different positions. By adjusting how the patient is seated or standing, you can have them working in different ranges of rotation. This video demonstrates working on motor control in full rotation left, as the patient is seated in 45 degrees rotation right, so to reach the flag they have to naturally turn their head all the way to the left. As a gaze stability drill, you can have the patient looking at the center of the flag with their eyes at the red dot. You can then instruct them to trace a laser over a butterfly tracking pattern while maintaining their eyes in the center of the flag. The clinician can stand by and watch the patient perform this exercise to make sure their eyes are staying locked in the center of the target and not deviating with their head movements. Another innovative way to monitor gaze stability, as well as take an objective measurement during the test, assessment, or training, is to use a smartphone and the motion guidance contact pad. The contact pad can stick on the wall, and the phone can stick to the contact pad. You can have the patient stand close to the phone and then turn on the laser. This way the phone is recording where their eyes are aimed during the test. As the client looks into the phone, they can be instructed to turn fully to the right or left or up or down. You can record the exercise on the phone and watch this with your client. This will give an objective measurement to whether the patient is able to stabilize their gaze during different head motions. You can also test the client's ability to locate different targets, moving slow or fast in between targets, and attempting to stop on point at the target. Deviations seen could be undershooting the target or overshooting the target. To further challenge them, increase the speed. You can add complexity to simple tasks such as walking by adding a visual feedback exercise drill, such as walking while practicing cervical fine motor skill. You can also use the visual feedback to maintain a static target during movement. This video shows indirect rotation right. The client is instructed to walk forwards and backwards while keeping the laser on target. You can add visual feedback to any balance exercise, such as standing on one leg, or standing in tandem stance. But you can also add complexity by having the patient perform a dual task, such as performing an upper extremity motor control task while balancing on one leg. You could also have the patient perform a cervical motor skill task while standing on one leg. Other options would be reaching or adding upper extremity resistance band. You could also add a cognitive task to challenge the patient, such as having them read off numbers or spell things while doing the exercise. We would like to thank you for watching this demonstration of the motion guidance visual feedback system, and invite you to check out our website, www.motionguidance.com, to learn more about our product and view different applications of how you can add visual feedback in clinic with your client.